Mr. Chairman, do you have any words for us this morning? Do any members of the committee have introductions? Madam Secretary, call the roll.
Senator Adams, Senator Douglas,
Present.
Senator Harper Angel, Senator Higdon, Senator Howell, Senator Mays Bledsoe, Senator McDaniel, Senator Nemus, Senator Thayer,
Here.
Senator Thomas, Representative Banta,
Present.
Representative Bratcher,
Here.
Representative Callaway,
Present.
Representative Kleins,
Here.
Representative Dixon, Representative Pfister,
Here.
Representative Flannery, Representative Gentry, Representative Heverin, Representative Herron, Representative Huff,
Here.
Representative Jackson, Representative Kulkarni,
Present.
Representative Meredith, Representative Palumbo,
Here.
Representative Pratt,
Here.
Representative Smith, Representative Timoney, Co-Chair Cook, Chairman Schickel.
Present. Let the record reflect we do have a quorum and are duly constituted to do business. At this time, I'll accept the motion to accept the minutes from the last meeting.
Second.
Is there a motion? I hear the motion from the chairman. Is there a second?
Second.
Second being made. All those in favor use the voting sign of aye.
Aye.
Anyone opposed, like sign. Let the record reflect that the minutes have been approved. Couple announcements before we get started. We do have a lengthy agenda this morning, but at the bill sponsor's request, item number 6 will not be on the agenda this morning and be passed over. I also want to tell members that some months ago we stopped mailing agendas to members, but the committee would still be happy to mail you an agenda if you would like an agenda mailed to you. Several of us do get our agendas mailed to them. If you would like to be added to the list, just contact our able staff and they would be more than happy to add you to that list. The first item on the agenda this morning will be item number 7, Riverboat alcohol sales. Senator Jay Williams, welcome to this committee. I believe it's the first time you've been in front of this committee since you have returned to the legislature. It's great to have you here, a fellow Boone Countyan. Introduce yourself for the record and proceed with your testimony.
Senator Jay Williams from the 20th District, River District, comprising boundaries of the Kentucky River and the Ohio River from Boone County to Frankfort. And that's what we're here to talk about. I have a guest.
Allison Deppenbrock from here in Frankfort and Franklin County, Kentucky River Tours, one of the captains here.
Proceed.
Thank you very much. This is probably in my afterlife, I'm trying to simplify things, the simplest amendment I've ever done. We're simply changing the definition of riverboat from 100 to 40. The purpose is Kentucky River Tours has difficulty getting 100-person boats through the locks on the Kentucky River. Nathan Deppenbrock, who actually is a Boone County native, is out on a tour right now, earning money for all of us during economic development. They have 50-person or 40 some odd person Coast Guard approved boats, and this simply drops the license for liquor and definition of riverboat from 100 to 40. So if there's any questions, we'll be glad to entertain them. Other than that, it's a very straightforward, simple change, primarily to promote economic development on the Kentucky River through the locks.
Pretty straightforward. I see the language is in your packet. I believe it's on page 10 is the change in BR number 463. Madam, Ms. Deppenbrock, would you like to say a few words? It's great to have you here. You're a great Northern Kentucky family. I play pickleball with your relatives. And do you have anything to say to this committee?
The only thing that I want to say is what a gem we have in the Kentucky River. It's a beautiful river. I'm so proud to be on the river every day. We have a motor coach tour today of 42 people from out of state on the river right now on our vessel. And we just think that having bourbon tastings where the bourbon was made is perfect.
I agree. Welcome. Thank you all. Are there any questions? Go ahead, Senator.
Thank you, Mr. Chair. Would you help me there with the definition of trouble? We use a lot of words and we assume that everybody knows what that means. When you say trouble through the locks, would you explain to those people who are either listening or watching what troubles you're having?
So our locks are smaller locks than what are on the Ohio River. The Ohio River has large locks, 1,200 to 1,600 foot long locks. Here in Kentucky, on the Kentucky River, our locks are made for the smaller barges, which were 145 feet long. So we don't have all of that room to have a larger paddle wheeler per se that would hold 100 people plus to fit inside that lock. Our boat that we have right now is 52 feet long. So we have room, but it could, if we had a paddle wheeler, it wouldn't be able to make it here.
Thank you very much. Thank you, Mr. Chair.
You're welcome. Anyone else? Thank you all for being here, and look forward to seeing this in this session.
Thank you very much.
Thank you very much, Mr. Chair.
I also want to let the record reflect that the ABC was contacted, and I guess for some reason they're not here. The next item on the agenda will be item number 3, free birthing centers. This is something that has been before this committee several times. Interesting discussion. We had it scheduled early this year, and at the bill sponsor's request, we delayed that so we could maybe get some things worked out with some of the stakeholders. I'll be interested to find out whether anything has been worked out or not. Senator, it's great to see you here again. State Representative Nemes, great to see you. Introduce yourselves for the record. You can introduce your guests and proceed with your testimony.
Thank you, Chairman Schickel, and we do appreciate you adjusting the agenda for us. I'm Senator Shelley Funky Frohmeyer, Senate District 24, which is Campbell, Kenton, Pendleton, Bracken, and along the beautiful Licking River and Ohio River.
Mary Catherine DeLoder from the Kentucky Birth Coalition.
Representative Jason Nemes represents Jefferson, Oldham, and Shelby counties.
Well, as I said, I'm here on behalf of the Kentucky Birth Coalition, a grassroots coalition of families who want more options for childbirth in the Commonwealth. And once again, we're here to talk about freestanding birth centers. This committee heard this topic last year during the interim, and you heard about it in your respective committees in both chambers this past session with the companion bills, House Bill 129 and Senate Bill 67. As a brief reminder, this legislation achieves two primary goals. It modernizes the existing facility licensure requirements for freestanding birth centers, and it removes the unnecessary certificate of need barrier for these facilities. And for those who may not know, certificate of need is a process where a proposed health facility must first prove a need for the facility before being granted permission to open. And the process allows for competitors to oppose the new facility. Freestanding birth centers are not a new concept for Kentucky. We have existing regulations for licensing and for Medicaid reimbursement. However, we have no freestanding birth centers since about the 1980s, and this legislation seeks to change that. As a recap, a freestanding birth center is a physical location other than a hospital specializing in normal childbirth without common medical interventions. It's different from a home birth in that it is a destination for birth rather than a private residence. Birth centers provide a home-like setting where care is focused on its family-centered care, holistic wellness model. Birth centers do not offer surgery or anesthesia, and there are no epidurals or pain management drugs used for labor, although there are non-pharmaceutical forms of pain management, such as movement and water therapy. Mothers who choose a birth center receive a full course of prenatal and postpartum care. Today, we have Kentuckians crossing our border to give birth at nearby birth centers in Indiana and Tennessee. There are around 300 birth centers nationwide, and Kentucky is one of 8 states that have 0 freestanding birth centers. Those who oppose this legislation would want you to think that birth centers are dangerous, but the peer-reviewed literature that exists shows that birth centers are safe. You have a handout in your packet that has some citations for several studies, and I'd be happy to follow up with anyone who would like more information on any of those studies. And I'll let Representative Nemes tell you what we did in the House.
Thank you. I'll just be quick and give a quick background on what we've done before. This will be the 5th year, Mr. Chairman, that I've filed this bill. There are 13 in the House, 13 co-sponsors, many of whom are on this committee. In this past session, on February 22nd, we passed this bill out of this committee. Thank you for that, Chairman Cook. And the vote was 18-0 with 2 passes. I want to say that we over the years we've made a lot of improvements, a lot of changes at the request of various parties, including ACOG and the Kentucky Hospital Association. And I will say that while the Hospital Association are our friends and they do a whole lot of really good things for our people, I think the reason, because remember, we have to get licensed to make sure everything is safe and so forth. The reason for the opposition here, and I don't disrespect it, I'm just calling it straight, is market protectionism. And so if that's your jam, then fine, it's not mine. And so that's where we are, and I think I'm hoping that we can get it past the finish line this year.
And I wanted to acknowledge as well, in Senate Bill 67 that I filed on February 7th, it had tremendous bipartisan support, or I would say nonpartisan support. But the reality is I did have co-sponsor Schickel, Adams, Armstrong, Deneen, Harper, Angel, Neal, Southworth, Tishner, Williams, and Yates. And again, it was brought back into the Committee on Licensing and Occupation. We had 9 yes votes and 2 no votes. On March 7th, we made some adjustments to the bill, brought it back into committee, and we had Senate committee substitute with 7 yeses, 3 noes, and 1 pass. So we're doing tremendous work on this, and I'll follow up to acknowledge that some of the changes we made was to reduce to 4 beds. We addressed that regulations for malpractice insurance would be added, and we did. Also, that uniform language of freestanding birthing centers to be unified throughout the KRS. It's inconsistent right now. And then we want to reiterate those responsibilities of the freestanding birthing centers regarding the vital statistics and newborn testing. And all that came out of the last session. So I think you'll see something that is very attractive in this coming legislative session.
Senator, I did want to ask you, and we got 3 people signed up that want to speak against the bill, and I want to respect their time in just a minute here. But are we making any headway as far as getting agreement on this, or are we still kind of loggerheads?
I feel like we are making some headway. I convened 2 different gatherings. St. Elizabeth was a wonderful host and allowed us to have 20-plus stakeholders. I did acknowledge that perhaps not enough mothers that I had at those convening sessions that were just speaking on behalf of the desire for a more holistic model. And we have acknowledged that there are midwives in the midwifery could be available at some hospitals throughout Kentucky, but we're still recognizing that we have a serious maternal health deserts throughout Kentucky. So that's been brought to the table during 2 of our sessions that we convened over the interim thus far. And we're reinforcing some of the changes that we made at the last session and have added to the bill. So there are some differences.
I want to thank you for your advocacy and not only your advocacy, but the manner of your advocacy. You really have done this with dedication and balance and patience, and sometimes with these issues like this, it takes a lot of patience, and I appreciate the way you've gone about this. Are there any questions for this panel before we move on? Representative Bratcher.
Are you going to have any opposition on this, or why is this thing taking so long to pass? I mean, it's in Indiana. Did we pass it in the House?
We passed it in the committee 18-0, and then the action was in the Senate last session.
All right.
Representative Flannery.
Thank you, Mr. Chairman. Just a couple questions, if the chair would indulge me. How many, on average, how many deliveries require a C-section?
From a birth center?
Just any during labor, whether
We do appreciate that question, and there'll be some folks that will be able to answer that follow us. because the hospital association and the hospitals are the only places that can offer that currently.
Yeah, I'm just asking, I guess as a midwife, she may know of how many
So
deliveries require on average a C-section or some sort of surgical intervention.
So I'm not a midwife. I want to clarify that. Okay. I'm a mother who's an advocate for expanded birth options in Kentucky. Kentucky has a very high C-section rate, higher than is recommended by the World Health Organization. It's in the 30%, I believe, the last time I've looked at that. It's believed that a lot of C-sections result from interventions that occur in the hospital that may seem like they are innocuous interventions, but sometimes that leads to a cascade of interventions or a domino effect that results in needing a C-section that was not planned. Some C-sections are necessary, but lots and lots of research shows that we have a lot of unnecessary cesareans in our country as a whole.
And we will get back with you with that exact statistics. It was provided to us sometime last Health Delivery Systems Task Force in June. So I'll be eager to pull that up and provide that to you. Thank you.
Comment, Mr. Chairman?
Did you have another follow-up?
Just comment.
Go ahead.
My concern is not market protectionism, but the protection of the mother and child. There are situations where a child is malpositioned. It could be breech or transverse, and surgical intervention is necessary. And I think this bill, as it stands, recognizes that a transfer is a possibility, and it should be. So I'd like to know a little bit more about the statistics on how often surgical intervention is necessary. And my concern is putting a mother or the soon-to-be born child at risk, and I just think we need to really think through this and be sure that we're not jeopardizing the safety of the mother or child.
Mr. Chairman, can I briefly respond?
You may, and that you'll have the last word.
The great thing is in Kentucky, we don't invent the wheel. We wait 20 years after it's over at the quickest. And most states, the overwhelming majority of states already have this. The studies, are some of them referenced in the materials that you have, suggest that they're perfectly safe. I would also note, Representative Flannery, that in Kentucky you can have a birth at home. And a lot of the women who would be choosing this option would otherwise have them at home. So it would be a more safe environment for that person. So I think it's high time that we get on it in Kentucky, as most, I think, over 43 states already have. Thank you, Mr. Chairman.
You're welcome. Senator Thayer.
Thank you, Mr. Chairman. I'll respond to Representative Bratcher's question. I voted yes for the bill in committee, but the Senate didn't have the votes to pass the bill. Senator Funky Fromeyer made a great case for it in caucus. We had members who have the same concerns that Representative Flannery outlined. Sometimes we pass bills that you don't pass. Sometimes you pass bills that we don't pass. Sometimes we have things that we just don't have the votes for. Thank you, Mr. Chairman.
You're welcome. Senator Mays Bledsoe, and she'll have the last question to this panel.
Thank you, Chair. And just briefly, I did not get into all the details of the bill. One of the concerns I had originally was just when something goes wrong at a birthing center, what is the relationship with the birthing center to a hospital or to the next of care, and is that addressed in this bill?
So the bill requires, we're kind of elevating what is required for licensing in a birth center. So we are in this bill asking for birth centers to be required to be accredited by the Commission for the Accreditation for Birth Centers. That is the accreditation standard that is recommended by the American College of Obstetricians and Gynecologists for Birth Centers, as well as the Society for Maternal Fetal Medicine. In the document where they recommend that document is also supported by the American Hospital Association. And the accreditation, let me find where I've got that mentioned in my notes. So the bill itself requires to have transfer plans in place when needed, but the accreditation requires that birth centers have written policies and procedures for pre-planned obstetric and pediatric consultation services, transport services, and obstetric and newborn care in licensed hospitals. And so I had taken those notes directly out of the accreditation requirements.
Just brief follow-up. So if the birthing center is accredited, are the hospitals voluntarily, I'm just making a case, there's one in Lexington, do they have to have a relationship with all the hospitals, one in particular, as that transportation care?
That level of detail as far as like how many hospitals is not specified in the accreditation or in the bill. That could be something that the Cabinet for Health and Family Services addresses further in regulation if it's desire to make that more specific, but we're not addressing it to that level of specificity in this bill.
Got it. Thank you. I just wanted to raise the concern as someone who had an emergency C-section, who went in with great plans to deliver naturally, how those relationships work. That is my biggest concern, is the relationship from the birthing center to the hospital. Who's responsible for that care and that liability as it goes is something that I think we have to have addressed at some point. And I'm all for having more options for birthing centers. Thank you, Chair.
Okay, we are now going to ask you all to step back and stay nearby in case we need you again. But we have the Kentucky Hospital Association, looks like two folks from them, and St. Elizabeth Hospital. If you would come forward, please. You can all sit up there together, one big happy family. It's good to see you all. And we are going to give you 10 minutes for your testimony. Introduce yourself for the record and proceed with your testimony. Welcome.
Thank you very much, Chairman Schickel. I'm Nancy Galvani. I'm the president of the Kentucky Hospital Association. Two obstetricians with me, Chief Medical Officer and obstetrician with us today. So I can go ahead and start and just say thank you for allowing us to speak today. I also want to say a thank you to Senator Frohmeyer for meeting with our organization and listening to our concerns. Very much appreciate that. Also want to make it clear that we are not opposed to birthing centers. What we are here to talk about is our concerns and our opposition to removing birthing centers from the Certificate of Need program, and that comes based on the advice of obstetricians throughout the state. And again, our concern is for the health and safety of the mother and baby, and we feel that removing birthing centers from Certificate of Need and weakening the licensing standards would put women and babies at risk. This is really going to roll back decades of progress in maternal care because the number one problem and risk to birthing is hemorrhage. And so thankfully that is not a problem in the U.S. anymore, but that's because America's hospitals know how to treat hemorrhage. Birthing centers cannot treat hemorrhage. Hemorrhage is not something that can be predicted. It has to be expected and prepared for in all deliveries. And so we believe that this legislation contributes to putting women at risk. If a complication during birth arises, the birthing center, we feel, must be located either within a hospital, connected to a hospital, or in very close proximity to a hospital, because a quick transfer from the birthing center to the hospital is going to be critical to the life and health of the mother and child. The standards called for in the proposed legislation do not, I repeat, do not require a freestanding birthing center to have a written transfer agreement with a hospital. In fact, the accreditation standards that were referred to in the legislation specifically state, and I will quote, "A written agreement is not required between birth center and receiving facility. A birth center must only notify the hospital of the impending transfer, mode of transport, expected time of arrival, and upon arrival, the birth center midwife gives a verbal report and a copy of the records. Without those written transfer agreements in place, a complicated birth could easily lead to the death of the mother, the baby, or both. In other states, we've seen freestanding birthing centers have left a number of dead and injured patients, and there's been little accountability. These operations have difficulty obtaining malpractice insurance, and if an injury or death arises, they've simply declared bankruptcy and walked away. The standards being proposed in the bill also do not require that the midwives practicing in the birthing center have malpractice insurance. In fact, those standards consider a birthing center to be in compliance without the center or the midwives actually having coverage. The accreditation standards state, and I'm going to quote again for you, "If birth center and/or clinical providers or clinical staff are not covered by medical liability insurance, clients are notified of the fact." They're just told. So the proposed legislation would also remove the requirement for oversight of the facility by an obstetrician. That's currently in our regulations, with admitting privileges at the hospital. So again, we're not opposed to birthing centers, but we believe any legislation seeking to advance the building of freestanding birthing centers should at a minimum require the facility to be under the direction of an obstetrician, follow evidence-based risk assessment criteria established by ACOG, require both the facility and each clinical provider to be fully insured for medical malpractice, be attached to a hospital or in close proximity with an active written transfer agreement with the hospital, only permit nurse midwives to deliver at the center, and require certifications for advanced cardiac life support and neonatal resuscitation. There's about 52,000 births each year in Kentucky, and only 1,000 or less than 2% were delivered at home. Nationally, the rate of births occurring in a freestanding birthing center is even lower. It's 0.5% nationally of all births. And in Kentucky, that's going to equate to only 260 births in Kentucky statewide. So given the limited number of births likely to occur in these centers, the need for birthing centers should be reviewed under the full Certificate of Need program to assure that the center has sufficient volume to maintain the proficiency of its staff and to have quality outcomes. There was a study published in the American Journal of Obstetrics and Gynecology in 2021 that evaluated neonatal safety between hospitals and freestanding birthing centers. And it found that births in U.S. freestanding birthing centers are associated with an increased risk of adverse neonatal outcome, such as neonatal death, seizures, and low 5-minute APGAR scores. The authors of the study advised that women should be told that births in freestanding birth centers are not among the safest birth settings for neonates, compared with hospital births attended by either nurse midwives or physicians. Hospitals aren't opposed to patients having options, but our first concern is always with the patient's health and safety. And so at this point, I'd like to turn to our two physicians and let them make some comments.
Thank you for your testimony. You're halfway, there's 5 minutes left in your time allotment, so I just wanted you to be aware of that. Introduce yourself for the record and proceed with your testimony.
Thank you, Senator Schickel, and I'd like to thank Senator Funky Frohmeyer for working with my hospital. I represent St. Elizabeth Healthcare. My name's Elena Oak. I've practiced obstetrics in the state of Kentucky for 28 years. I'm the lead physician of our inpatient obstetric group, which receives all out-of-birth hospital transfers. So I do feel that I am highly competent and qualified to sit here in front of you. I'm a mother of 3. I delivered all 3 of my babies with a certified nurse midwife. I want to make it very clear that I am not anti-birthing center. I am not anti-midwifery care. In fact, I embrace these models of care. I am not here to tell you that birthing centers are dangerous, nor am I here to tell you that there is a financial interest in why I'm in front of you. I am here to talk about the safety of health care provided to moms and babies across the Commonwealth of Kentucky. It is important to understand that a birthing center birth is an out-of-hospital birth. These are not centers that are connected with hospitals. They can be, but there's a reason it's called a freestanding birth center. Okay? It is also important that as you consider this legislation, that you know the different types of obstetric providers. There are midwives and there are physicians. There are certified nurse midwives, and there are licensed certified professional midwives. I work with all 3 types of birth attendants and have dealt with transfers from all. Also, family physicians in the state of Kentucky do obstetrics. So I do feel that I speak to you today from the heart as much as I speak to you from my brain as being a scientist of obstetrics, okay? My big concern with this is safety. This bill does not have a safety net for the moms and babies in the state of Kentucky. There is no requirement. So you have to understand that the Commission for the Accreditation of Birthing Centers, which is in the bill, does not require that written agreement. We need a highly integrated, collaborative agreement with physicians and birthing hospitals to assure that birth is safe in Kentucky. These are models that are found elsewhere. They are not guaranteed by the CABC, okay? The other thing to think about, and it's always brought up, is our maternity care deserts. Catastrophic things can happen during childbirth. Thank goodness they don't happen very often, but catastrophic things can happen. And areas where there is limited access to care, do we really want to create legislation that can put a birthing center far from a birthing hospital? Because then you cannot deal with it in a timely fashion. Okay, so we have recommended that there be distance types of what am I trying to say here? Put a distance from a birthing hospital within the legislation that would ensure safety. We talk about C-sections all the time, and the answer to your question is it depends on the provider. Okay, some providers' C-section rates, obstetrician C-section rates are as low as 5-10%. Others are 50%. There are so many factors. But what I want you to think about in this case is we're dealing with two patients here. We're dealing with a mother who, yes, she is very concerned about having a C-section, but you're also dealing with a neonate who did not have a choice in the matter. And the data right now in the United States shows that babies are 2 times more likely to die when born out of a hospital. Now, that sounds really bad, doesn't it? 2 times more likely to die. It's 4 in 1,000 versus 2 in 1,000. This was an article published in the New England Journal of Medicine. I could throw a lot of data at you, but what we need to consider is the safety of the baby and making sure that we have agreements and making sure that babies are born close to facilities that can care for them. I would love to entertain any questions that you might have, but I do want to emphasize I'm not here to tell you it's dangerous.
Doctor?
Yes.
The time is up.
I'm sorry.
Yeah. And
Can
your
Dr. Golson talk? I talked too long.
Well,
I apologize.
You did. Yeah, and I'm going to give him an extension, but we
Thank
do
you.
ask that presenters do respect the time frames that they're given, because when you don't, then someone else suffers.
I'm so sorry. I don't have a clock. It might help if I had a clock to look at. I apologize. Thank you very much, though, for your
Doctor,
time.
introduce yourself for the record and proceed. You have 3 minutes.
Thank you, Mr. Chairman, and thank you to the committee members who are here. My name is Dr. Dan Goulson. I'm chairman of the Physician Leadership Forum in the Kentucky Hospital Association and also chief medical officer for the CHI St. Joseph Health System based out of Lexington and a board-certified anesthesiologist. Chairman, you have given me more time, and the comments that I'm going to make are very short, and they're about time. As Dr. Oak said, sometimes these consequences come about very quickly, and a normal course of labor with a normal mother can be normal until it's not. And once it's not normal anymore, the time is critical. We struggle with time even inside of hospitals. There's an anecdote, admittedly it's an anecdote, but one that got my attention, that within one of our rural hospitals, there was a course of labor that was proceeding normally, but the fetus became distressed. And indications were building that a C-section needed to be done in order to deliver the fetus before they became so distressed that it was past the point of no return. The obstetrician had a little bit of trouble driving into the hospital and was delayed. And the situation got more and more dire to the point that the team decided to call down to the emergency room, and the emergency room physician came up and started the C-section in order to save the baby's life. That's in a controlled situation. It is an anecdote, but it's kind of a shocking anecdote. By the way, that baby did fine and the mother did fine. But if that emergency room physician had not been able to start and more minutes had passed, the outcome would have been very different. And I encourage the committee to think about that factor when considering freestanding birthing centers.
Thank you, Doctor, and thank you for respecting the time perimeters. Are there any questions from this panel, from this committee? Would you like for them to come back? I don't think we're going to do that just because of the length of the agenda. I do want to make one comment because I'm a supporter of this legislation as chairman of the committee. For me, it boils down to this. Is there anywhere geographically in Kentucky you're not allowed to have a home birth?
No.
And who decides whether they're going to have a home birth or not?
The patient decides, and
I would say the
it's
parent
informed.
decides, not the patient. Yeah.
Well, the mother,
Right,
the mother
exactly.
decides where she wants to have her baby. Yes.
So what's the difference?
What's the difference between a home birth and a birthing center birth?
Well, my point, I guess, is this, and I respect your testimony and appreciate your testimony, but at the end of the day, who makes the decision?
The mother makes the decision where she wants to have her child.
And you're
yes.
asking to take that decision away.
No,
from
sir. I'm not asking to take that decision away at all. I'm asking that you support legislation that ensures safety at birthing center. I am all about birthing centers. I love the data coming out of birthing centers. For low risk mothers that give birth at birthing centers, the data is beautiful. It's fantastic. I'm in support of birthing centers.
So a mother couldn't have, so it should be outlawed a mother to have a home birth in which you would consider high risk at home. That should be against the law too.
No, it should not be against the law. It should be informed consent. I deal with patients all the time that choose to have their babies at home. It's not against the law to be high risk and deliver at home, sir. And that's a choice that every mother can make. Absolutely.
Thank you for being here.
I think can I have permission to just address one other thing? Patients don't know what they don't know. Let me say that again. Patients don't know what they don't know. I have mothers every month that are failed home births that come in. Many of them just need a little epidural and some help, and we achieve a beautiful vaginal delivery. I also see catastrophic things happening at home.
Thank you for your testimony.
With babies. So
thank you for your testimony. That's going to conclude this on the agenda. Thank you all for being here. The next item on the agenda will be item number 5, Kentucky Distillers. Welcome, gentlemen. It's good to see you again.
Good morning.
Introduce yourself for the record and proceed with your testimony.
I'm Jack Mazarak with the Kentucky Distillers Association.
And Chris Nolan, a legislative consultant with the Kentucky Distillers Association.
Good morning, Chairman Schickel, Cook, and L&O members. By this point, no doubt you've heard that bourbon is doing well. We have now distilleries operating or under construction in 41 of Kentucky's 120 counties. These facilities create well-paying jobs and support a supply chain that includes forestry professionals, coopers, logistics experts, marketing and creative agencies, and of course, the local farm families that grow our corn. Kentucky distilling is attracting record tourism from across the nation and the world, with over 2 million visits to our distilleries on the Kentucky Bourbon Trail last year. These visits fill our hotels, B&Bs, restaurants, and downtowns. Distillery employees are producing more barrels than ever. This is pushing Kentucky to a record number of barrels aging. Kentucky bourbon's rising success the past decade has been generously supported and propelled by legislation that you and your colleagues have passed, from authorizing new privileges, ensuring access for consumers, and keeping Kentucky competitive, to strengthening responsibility initiatives. The industry would not be at this point if it weren't for the dedicated work and often tough decision-making that you all provide. To that end, we're keeping our 2024 agenda short. Our top priority is limited self-distribution for craft distilleries. Those are only the ones with a Kentucky Class B distiller's license. As our craft distilleries are starting up and trying to grow their brands, it's vitally important that they be able to self-distribute a limited amount of their products. In time, many of these craft distillers plan to grow their volumes to the point of becoming a Class A distillery and attracting substantial attention from wholesalers. The sales they can make now through limited self-distribution, if allowed, would be key in bridging that gap. As guidance in this effort, we're using L&O's prior work on limited self-distribution for beer and for wine. Our negotiations with our partners at the Wine and Spirits Wholesalers of Kentucky are positive and moving rapidly toward an agreement. Our goal is to bring your L&O committees a solution to approve, not a problem to mitigate. After that, there are only a handful of items that we've been asked to provide input and feedback on.
Thanks, Jack.
Thank you for that concise testimony, and I'm glad to hear that you're working on an agreement. I know that you were meeting as recently as several days ago. Chris, welcome. Proceed with your testimony.
Thank you, Mr. Chairman. Another issue we'd like to address is vintage spirits. The General Assembly passed the most impactful vintage spirits law in 2017, making Kentucky the premier tourism destination for the best bourbon libraries in America. There are more people coming to the Kentucky Bourbon Trail than ever before, and it keeps growing. They expect to sample and buy things in Kentucky that they can't get anywhere else, and that's where vintage spirits fits in perfectly. Visitors are able to sit in a distillery tasting room or a bourbon bar or restaurant and sample the various expressions released over the years, such as an Old Forester birthday bourbon or a Four Roses limited edition, which are now out of stock and will never be crafted in the exact same way again. 6 years into this law, we've learned from experience that we need to fill in some of the gaps and make some adjustments to the law, such as linking this privilege to a separate license, increasing reporting for more transparency, creating an educational training component, and putting more teeth into the penalties for better enforcement of those who choose to violate the law. That may sound like a lot, but it's just a few small steps that will create a more robust and transparent system to maintain our stature as the one true authentic home to the best bourbon libraries in the country.
Thank you for your short and concise testimony. You get bonus points when you don't use all your time. Chairman Cook, I believe you have a question or comment.
Yes, sir. Thank you, Mr. Chairman. Jack, Chris, thank you for being here today. I just want to comment on the self-distribution. We did this last year for wine. This is so important. These men and women out there living an American dream. They're starting their own business. They're starting to distill, or last year's case, they were starting to make wine. And then they couldn't get anybody to pick their product up. And even if they could find an end user for it, they had no middleman to sit there and make that. And so, in my opinion, the only thing that's up to debate for is the gallon limit that you're going to put on it. But I look forward to supporting this, and let's get this done. So thank you.
Senator Thayer.
Thank you, Mr. Chairman. Thanks, gentlemen. I support both these measures. Obviously, it's more of the removal of artificial barriers to free enterprise. There's been a lot of headlines in central Kentucky here about the Vintage Spirits Act. I think that the ABC has gotten overly litigious and prosecutorial. Instead of working with some of these stores to try to work through some of the issues, they've basically turned into a Gestapo and conducted raids. So whatever we can do to clarify this so as the ABC doesn't have trouble interpreting the statute that we passed, because previous ABCs didn't have any trouble. This one does. So let's just make sure that the language is clear so that there's no confusion. So let's get sponsors for these bills and get them rolling early in the session. Thank you, Mr. Chairman.
You're welcome. Representative Banta.
Yes, Chris, this might be for you. Does this in any way make it harder for retailers to get bourbon for their stores?
No, and in fact, the Vintage Spirits allows retailers to get more product and put it on their shelves.
So it reduces restrictions for them. I just get a lot of retailer complaints.
Sure. Yeah, we just want to put some, as Senator Thayer said, put some transparency behind the laws that are already on the books to make sure everybody can see where the products are coming from and where they're going. So it should not be more restrictions on a retailer.
Okay. I'm just worried about cumbersome and things like that, but you can talk to me about it later.
Okay.
Thanks.
Representative Palumbo.
Thank you, Mr. Chairman. I support whatever we can do to help our signature industry. Thank you.
Thank you. And Mr. Chairman?
Yes.
We did have two other small items we wanted to mention if you have time.
Go ahead. Like
So-
I say, bonus points when you don't use all your time and you haven't used it. Thank you.
Thank you, sir. Leader Thayer brought up the ABC, and we've noticed something that's come to light that you may be shocked to hear if you love bourbon the way that we do. Currently, the Kentucky ABC is required to destroy any spirits that they confiscate.
Oh, my goodness.
Once legal proceedings are exhausted. Horrific, we know. To remedy this, it may be possible to allow the ABC to auction any bottles that it deems safe to return to the marketplace.
Absolutely.
Then donate these proceeds to charity or to responsibility initiatives. We know there are some questions about the mechanics of that, how it would work, but we want to help charities instead of shedding a tear as valuable handcrafted whiskey is destroyed.
Oh, my goodness. Yes, thank you for calling that to our attention. You know, there's folks that want to destroy guns, too. That's very ridiculous, too, but yeah. But go ahead there. Chris, did you have something else?
Yeah, and our last item, one of our upcoming priorities, either in 2024 or thereafter, will be to address parity on ready-to-drink cocktails. Commonly referred to as RTDs, these are new products on the market that the KDA believes needs to be addressed in two particular aspects of the law. The first is taxes, and the second is channel access, or otherwise where the RTDs are sold. Right now, Kentucky, like many other states, taxes RTDs on the base alcohol content. That is such as a malt base or a wine base or spirit base of that ready-to-drink cocktail, even though they contain the similar amount of alcohol by volume. For example, a can of Jack and Coke with 7% alcohol by volume with a whiskey base is taxed at the spirits rate of $1.92 per gallon, whereas a malt-based RTD, like a Truly, are taxed at 8 cents per gallon. We feel there should be more parity in the tax structure for spirits-based RTDs. And for the second component on channel access, we strongly believe that if the alcohol by volume is the same or similar as malt and wine-based RTDs, then spirits-based RTDs should be available to consumers in the same retail establishments, such as grocery stores and convenience stores. At a future committee meeting, Mr. Chairman, we'd love the opportunity to do a Pepsi challenge, if those of you that are old enough to remember what that is, and do a blind taste test between a High Noon or a Cutwater, which are spirits-based, and a White Claw or a Truly that is
They
malt-based.
call this the fun committee, but I don't know. That may be going, I'll have to check with my co-chair on that. And yeah.
We think the similarity will surprise you, so why restrict their sales to different retail locations would be the point. So we're making you aware of this today in case it bubbles up to the surface, and we plan to start educating legislators on how to make these
Well, as
legislative
President
changes.
Stivers tells me, your comments have been duly noted.
And that concludes the issues we wanted to talk about today, and can answer any additional questions that you all may have.
Are there any questions from these two distinguished guests? It means you did an excellent job. Always great to have you here in front of the committee representing one of Kentucky's signature industries.
Thank you for having us.
Thank you.
You're welcome. The next item on the agenda will be minimum age enforcement, T21, item number 4. I believe we have some students here from Senator Thayer's district who he wants to introduce. Great to have young people here before us. I'm going to defer to Senator Thayer for his introductions.
Thank you, Mr. Chairman. Sydney and Griffin are joining us today. They are students in Scott County, and I've met with Sydney before to talk about this bill, and I told her the thing she needed to do is get before the Licensing and Occupations Committee, testify and see if there's support for it. So I'm glad that they're both here today.
Yes, and I like to see people that know how to dress in front of the committee too. Dress properly. You look awful sharp with your tie and coat on there, young man. So welcome to this committee, and proceed with your testimony. Look, is that Dad there, or is that? Oh, okay. Okay. Well, welcome. Introduce yourself.
My name's Tony Weaver. I'm an internal medicine specialist from Moorhead.
My name's Griffin Nemeth. I'm the Youth Advisory Board Coordinator for the hashtag I Can Then Interim program at the University of Kentucky.
My name is Sydney Schaefer. I'm a resident of Scott County, and I'm a student advocate for the American Lung Association.
And we have 10 minutes allotted for this presentation.
All right. Thank you, Mr. Chairman. As somebody who has experienced the seriousness of lung disease in my own personal life, and what nicotine products can do to people, as I've experienced in my school and in my community, I feel that this issue is very important. I have read stories in the news countless times about youth e-cigarette use, and this epidemic that we are now seeing in our state of Kentucky. And so I am especially aware of everything that is playing out in our state right now. And so I really wanted to do something to help. And like I said, I've been doing this for many years. And so when I was 11, I decided that I would start advocating for people my age, and doing things like this to try and help the people of our state. I'm grateful to have had the opportunity to sit with my own senator and representative a few times to talk about policy to help protect kids from nicotine addiction and future of nicotine-related diseases. I stood next to former Kentucky Senator Alvarado in the Capitol advocating for passage of the T21 law about 5 years ago, and I'm grateful to sit here today in front of this committee and ask for your help. I think we all know that kids were targeted and are still continuing to be targeted with cool, advertising campaigns that we're really seeing, and lured in with fruity flavors in terms of vaping and e-cigarette use. And so they are enticed with cool-looking devices, cool-sounding flavors, and clever marketing is the bottom line, and they're being fed high levels of nicotine that addict them very quickly and can elevate very fast. And we also know that there's a law in Kentucky against selling these products to kids, but this issue is still continuing to happen within our state. Kids are getting their hands on these products still with this law. And so we are here to ask you today just for enforcement of the law that already exists to keep these kinds of products out of kids' hands, and have thorough regular store checks and penalties for illegal sales practices, just like we have for alcohol in the state of Kentucky. A law against selling to kids is only as good as its enforcement. And right now, that's not enough. And kids in Kentucky need your support. And Griffin will share more about why that is so important. Thank you.
Thank you. And, I want to comment just on your testimony. Excellent job, and I like how brief you were. But I like it when someone comes before this committee and doesn't ask for additional laws, but wants enforcement of our present laws, because so often we do that here in the legislature. We stack law onto law onto law, but none of them get enforced. And so I think that was an excellent point.
I appreciate that. Thank you, Mr. Chairman.
Good morning, and thank you for this opportunity to be here today. As I said, my name is Griffin Nemeth, and I'm the Youth Advisory Board Coordinator for the hashtag I Can Then Interim program at the University of Kentucky. We are a peer-to-peer tobacco prevention and education program. Our college facilitators travel across Kentucky to elementary, middle, and high schools, and we educate students on the various health effects, social, financial, and effects of vaping. And this is all with the end goal of reducing e-cigarette use across youth among Kentuckians. And today I'd like to tell you, after reaching over 19,000 students through our 4 years of being in this program, what we have learned from them about their schools and communities. Under strategic marketing and tactics by the industry, Kentucky is suffering, and its youth are no exception. This past year, the youth e-cigarette usage rate among Kentucky high schoolers has surpassed that of the national rate of adult cigarette usage. What we as a state have worked so hard for so many decades has been tarnished by the practices of a corrupt industry which disproportionately targets youth without shame, without denial, and without any sign of stopping. And if it is not enough to hear it from the words, from the mouths of these industry executives themselves, have a quick conversation with any number of staff or faculty from any number of Kentucky colleges or schools. Or take a quick walk around any of Kentucky's beautiful communities. But see that there is a problem. See that there is a problem. You'll be drawn to an uncanny sight in the true extent of this epidemic. These products were not made available to young people, but they were placed in their hands. They were placed in their hands. And the choice of whether or not to use them, well, that was never really theirs in the first place. Our Youth Advisory Board is a group of dedicated high school advocates, such as Sydney, who we transform into better preventionists and professionals through mentorship and skill building. Students like these wonderful advocates exist in every school and every college, and they are concerned. It is our job as adults to protect them from the harmful effects of nicotine, and the nicotine use rate among Kentucky high school students, as I said, has gone up in recent years, and this is much a problem. It has become a new social norm. Our students are worried. They're worried that their classmates and the futures of those classmates are going to be tarnished, and that they may never achieve those futures because of the deceit and manipulation they're subjected to through social media advertising, Kentucky law not being followed by retailers, and most importantly, misinformation that they are unable to discern from truth, because many of these students who initiate use of e-cigarette products are 9 or 10 or 11, and they are kids. It is our job to protect them, and thus far we have failed. What we're here to ask of you today is simple. We understand that enforcement of current Kentucky law, be it with regular compliance checks and strict penalties for violations, is the best way to protect these students and to make sure this issue does not progress to be any worse. Ask our neighbors in Ohio, West Virginia, or Indiana, or look as far as Massachusetts or California, but see that their efforts to combat youth nicotine access have worked. We understand that many of you support these efforts, and we are now kindly asking you to see it through. Thank you. And I'd like to invite Dr. Weaver now to share his clinical expertise.
Welcome, Doctor.
Thank you very much. I am obviously the old man of the group. Before this meeting started, I was actually explaining to Sydney what a telephone party line was, and she was absolutely astonished. I came back home to Kentucky to practice medicine in 1986. At that time, my 2-year-old daughter could legally buy cigarettes. The hospital where I worked allowed patients to smoke in the bed. I would come to work every morning in a fog of tobacco smoke. I could actually swirl the air with my hands and see the eddies in it. Of course, the newborn nursery air was toxic to the babies. And look how far we've come. And thank you. Just for a moment, just stop and say thank you for how far we've come. I started practice treating people with emphysema, lung cancer, heart disease. They were smokers. Almost all of them were smokers. And what I noticed was they all started before age 10. A handful of people before age 14, nobody after age 20. And I'm pretty sure no one in this chamber is thinking about taking up vaping or e-cigarettes at this point for the first time. What it meant, though, was they were addicted to the nicotine before they had the chance to make an adult decision. Well, we've come a long way. But as the other two speakers have pointed out, still way too many Kentucky kids addicted to nicotine as they grow up. I think e-cigarettes are dangerous. I think vaping is dangerous. The time will tell how bad this is. We're running an experiment right now. But what we do know is that it contains propylene glycol as a base. That's antifreeze. It's got something called acrolein in it, which is weed killer. It's got heavy metals in it. And, of course, it has the nicotine, which is toxic to blood vessels. I feel it is unconscionable for a business to make a business of getting our children addicted to nicotine. And Griffin said it better than I can. And we're asking this committee, we're informing them, we really would like to work on enforcement of the T21 law. Thank you.
Powerful testimony from this group. Very impressive. I want to ask a question because I have a constituent ask me about this a lot, and I have to admit that I don't know much about. Back in the day, we used to smoke regular cigarettes in the men's room in school and sneak, but my stepson tells me that now it's all this vaping. It's not regular cigarettes. What's the term Delta 8 mean? Is that one of these products, or what is that?
Well, we're focusing on the e-cigarettes, and 99% of them have nicotine in them because that's really what hooks the kids. As I recall, now I'm not an expert on this. I'm an internist, a doctor for adults, but Delta 8, I believe, if I'm correct, is a form of cannabis. Yeah. So it is one form of cannabis. You can put it in an e-cigarette. You can't smell it.
Is that legal to buy, though? I'm hearing yes and no. I think it is.
Yeah.
Yeah, I think it is legal. Yeah. Yeah, there's a lot of confusion about that.
Yeah, there's a cannabidiol, which is legal in many forms, and then there's the THC, tetrahydro.
Okay, we have quite a few questions here, so we're going to work our way through them. Chairman Cook.
Thank you, Mr. Chairman. Gentleman from Scott, long before that young lady became a constituent of your all, she was from Bourbon County. And I know it maybe seems like a long time for you, Sydney, that we were doing the pickup at Pleasant Street Preschool, but for your dad and I, where'd he go? There he is. It seems like just yesterday, and we were trick-or-treating and doing preschool pickup. So I just want to say great job today, and congratulations, all you've done. Your testimony was great, and we're proud of you, and we love you, and keep up the good work.
Thank you so much.
Representative Tenemy.
Thank you, Chairman. I have a question and a quick statement.
Proceed.
Okay. Vaping is, it's wildly out of control. Just to make it, I'm big at making these big elaborate statements, but it is out of control. I know our schools are really, really struggling with monitoring. And I was reading a post the other day about teachers discussing, if they do it without me really paying attention, like that's how bad it is. It's like cell phone usage in the classroom. Like that's where we are. It's from the research that you all have seen. Are parents just not understanding of what this is?
Representative, many parents understand that their students are using these products and they're concerned, but they don't know how to properly address the issue. And they're looking to teachers and school administrators to set the record straight for them about how they need to approach their student with this. But unfortunately, with what we've seen, parents don't feel comfortable. And so school administrators lacking the knowledge that we've seen in the research, not being able to deliver it to those parents, this is not really solving the issue at all.
Keep in mind, it is an addiction. And so the kids would find a way, even without the parents' permission.
Well, and in conclusion, Mr. Chairman, these vape devices, this is a Pandora's box. It starts with nicotine, and they can be interchanged with any number of things. And this is something that we definitely need to get a handle on. I don't know if it's through community education as well as some policy. However, one of the things that must happen is, our parents need to know that they are in charge. They're their children, they are in charge, and therefore, if they're doing something they don't want to do, they shouldn't be allowed to do it. Thank you, Mr. Chairman.
You're welcome. Senator Mays Bledsoe, you have the last word.
Wow. Thank you, Mr. Chairman. Thank you both for your testimony and what an elegant way of articulating a really big concern and a problem with our high school and junior high kids. As a mom of someone in those age groups, I've seen it firsthand. I talk to other moms whose kids are buying and selling vapes that have laced with all kinds of things, with fentanyl and others. And they're doing it on Snapchat and social media. Their parents have no idea. And you ask how it goes on, because they do it in their bathrooms. It's quiet. You can't smell it, can't see it. And it's easy to hide. And it's highly, highly addictive. One of the things we talked about in the last tobacco settlement meeting was about the UK program for peer-to-peer and how effective that has been at trying to get kids to realize this is not an enforcement thing, but it's on them to say, we want to live a better life. We don't want to do this anymore. Have you seen that expand? Would you like to see that kind of program expand?
Absolutely, Senator, and thank you for your comments. Difficulty that we found in expanding comes from willingness to find people to educate. We understand that there are advocates in the schools like Sydney, but it's hard to find adults who are willing to stand up to this issue, or that they feel like they've seen it among youth, or feel that youth are the problem. We understand that youth are not the problem. It is the marketing they've been subjected to, and it is those tactics they've been subjected to. But we do have difficulty in expansion, but we would like to, nonetheless.
Dr. Douglas, you now have the last question.
Thank you, Mr. Chair. I really just wanted to address a couple of things that we've already mentioned. You mentioned, or you had the question about Delta 8. Delta 8 is in fact an isomer of the cannabinoid, and it is a dangerous isomer. We don't allow 7, but we do allow the other isomers, and that is something that I know we as a General Assembly will need to address sometime in the very, very near future. Ohio went down that road a few years ago, and what they did is they took their legislation back and they banned a lot of the different isomers from cannabinoid. The other point I wanted to make that I don't think a lot of people are aware of is that many of the products that are vaping products really aren't produced in the USA. They're produced outside the United States, and there is there's no clear designation to all the chemicals that are in these vaping products. And we're selling these things and allowing our children to get a hold of things when we really don't even have a handle on what's in these products. Thank you, Mr. Chair.
You're welcome, and thank you for a great presentation. Griffin, I do want to challenge you on one comment you made, and that is you said kids don't have a choice. And I don't know what context you made that in, but I want to disagree with that because we all have a choice, and we need to realize that we all have a choice, kids and adults both, to choose what we want to participate in. And we have to take responsibility for those choices, not put them on other people, but take responsibility for them ourselves. So I just wanted to make that comment. Thank you all for being here.
Thank you, Mr. Chairman.
And lastly, on the agenda, we have, I believe Tom Underwood's son is standing in for him. Thank you for your patience. Item number 8, marriage and family therapists. I appreciate you being so patient with me. And introduce yourself for the record and proceed with your testimony.
Yes. Good morning, Mr. Chairman and members of the committee. My name is Ryan Underwood. I am substituting for Tom Underwood. I am here as a private citizen to talk to you about families. Marriage and family therapists play a part in keeping families together. Marriage and family therapy is a solution-focused. It is designed with an end in mind. It does come with specific and attainable therapeutic goals, and the therapy is relatively brief, averaging 12 sessions. These therapists treat a wide range of serious clinical problems, including depression, marital problems, anxiety, individual psychological problems, and child-parent problems. Almost all counties in Kentucky have a severe mental health provider shortage. A licensure compact with other states will ease the entry of qualified therapists moving to Kentucky. Kentucky has already adopted licensing compacts for portability of licensure of experienced mental health counselors and also for psychologists. Adopting a licensure compact for marriage and family therapists will improve access to qualified therapists across the state. In addition to improving access to qualified mental health professionals, a licensure compact will ensure commitment to public protection. It will still require that any out-of-state therapist looking to obtain licensure in Kentucky must be in good standing with a valid and unrestricted license to practice as a licensed marriage and family therapist in another state or territory. This effort comes at no cost to the state and will likely provide a small increase in revenue, as out-of-state therapists will be required to pay full licensure fees in Kentucky in order to practice in the state. Strong families are a critical part of a strong society, and I appreciate you all.
So what are you asking for? And do you have language?
The marriage and family therapists are working on language right now.
Well, let's get it to us.
We will.
We need to see something in writing.
Absolutely, we will get that to you.
Here's the deal on these compacts, and you know this. You've been around a while. We all love compacts because they're convenient, but we also have a sovereign state, and we want to balance that with if we're giving up, the state's authority. So that compact's just like any other we do. And we'll have to take a look at it and balance those two things.
Absolutely. We will get that language to you.
Good. Any questions? Very well. Thank you.
Thank you.
I want to make one comment to the committee before we adjourn. There's been some question about remote testimony. It's come up several times just recently. I've made the decision not to accept remote testimony just because I think it's important that people be here. I think it's important for the committee. But if there's any committee members that don't like that decision, that think we should be listening to remote testimony, please let me know so I can maybe reconsider that. Anything else before we adjourn?